Welcome to Showcase Richmond. I'm Amy Carter. Sheltering Arms Institute provides physical rehabilitative care for individuals who have sustained a variety of illnesses and injuries. This is done through the organization's inpatient hospital and 8 outpatient centers across Central Virginia. Sheltering Arms Institute is ranked the top physical rehab provider in Virginia by U.S. News and World Report. And joining me today to talk about limb loss awareness and prevention is physical therapist Kate Hogue and occupational therapist Meredith Mayton. Great to have you both with me on Showcase today.
Thank you for having us.
Yes, and April is Limb Loss Awareness Month. How many amputations occur each year in the U.S. and what typically causes them?
That's a great question. So according to the Amputee Coalition, there are nearly 200,000 people who will have an amputation each year in the United States. So that equates to more than 500 cases per day. The top 3 causes for someone to have an amputation are peripheral vascular disease, diabetes, and then the third being trauma.
Wow. And if someone has experienced limb loss, what can they expect during physical rehab at Sheltering Arms Institute?
A primary theme of rehab after limb loss is safety. Our therapists work with patients to strategize their mobility with the intention to return home as independently as possible. A therapy plan will involve activities of daily living, getting in and out of a car, and preparing one's limb for a future prosthesis. At Sheltering Arms Institute, we are fortunate to have advanced technologies such as body weight support systems that are tools to help progress a patient's strength and mobility to get them to their highest level of independence.
No, that's amazing. And typically, how long does it take to recover from an amputation?
As far as timeline, we typically will see patients a couple of days after their surgery when they are discharging from the acute hospital. And so they'll stay with us for about 10 to 12 days at our inpatient rehab hospital. After that point, we like to transition patients either to home health, but ideally to outpatient therapy at one of our clinics. That time period after their surgery is really important, as Kate mentioned, just to help monitor the wound healing, but also to help prepare the residual limb for a possible prosthesis use later. So that time frame from when someone would have surgery to when they would be ready for a prosthesis is about 6 to 8 weeks. After that point, we enroll patients in an intensive prosthetic training program. And so that full cycle from an initial surgery to a functional mobility with a prosthesis is about 3 months.
Wow. Wow. We're showing video of you all working with different patients. It's just amazing to kind of see that process and the progress that someone can make in just that amount of time is truly, truly amazing. You all have a limb loss awareness event coming up. So tell me about that.
Yes, we do. We are excited to be hosting our 2nd annual walk, run, or roll event on our campus. It is to celebrate successes and promote awareness. We are planning to host this event on Saturday, April 20th at 2 p.m. We're fortunate to have several sponsors, including our host sponsor, Carter Myers Automotive. We have had great participation from the community, and we've been able to see some former patients run the race.
Wow.
We're excited for the community to participate this year, and our website has great information and registration information.
Awesome. Thank you, ladies, so much for joining me on Showcase. And we want to share with you all at home how you can get involved. Again, Sheltering Arms has 8 locations around Central Virginia, and you can contact them by visiting shelteringarmsinstitute.com or by calling the number right there on your screen, 804-877-4000. Again, 804-877-4000.